Hey guys, Dr. Childs here. Today we're going to be talking about the symptoms of menopause. Now, if you aren't familiar with menopause, we'll explain just the basics of menopause, how to tell if you're in menopause, by the way, because a lot of women just sort of slide right into menopause and may or may not go to their doctor, but do obviously experience and notice symptoms. We'll talk about why some women are affected more than others when it comes to these symptoms, and then we'll also touch on what type of treatments are available because yes, you can actually completely cure and reverse menopausal symptoms. So we'll get into that in just a second. If you don't know me, I'm Dr. Childs. I'm an internist and I specialize in treating patients with thyroid conditions, helping people with hormone imbalances, and of course, helping people lose weight. And today really touches on a couple of those areas. So menopause definitely touches on the hormonal aspect, right? And we'll talk about that in just a second. But it also touches on weight loss because a lot of women, as we'll get to this somewhere in here, weight gain, yeah. As we'll talk about one of the main symptoms that a lot of women experience is weight gain. But we'll talk about some of the more pressing issues that they tend to present to their doctors with. So what is menopause? And we'll just briefly touch over this. Menopause is what happens when your hormone levels as a woman drop. And we're talking specifically of estrogen and progesterone. So E2 is commonly used to refer to the most potent estrogen in your body, and that is estradiol. And P just stands for progesterone. Okay, so that's why I'm saying decrease in both E2 and progesterone. Now, what happens to a woman is once they run out of eggs, which are normally used for fertilization to have children, they have a finite amount of these eggs. And once they reach zero, or pretty close to zero, really, they reach this menopausal sort of experience. And what happens is that these hormones really decline rather rapidly. And these are really the hormones, estrogen and progesterone, which define or help to define how a woman is feeling, a lot of the characteristics that she may have, and a lot of important aspects of her health that she may not be realizing. So when these hormones decline rapidly, you will feel it. Okay, you feel it. Now, the degree to which you feel these symptoms really depends on a lot of factors. Number one is genetics, and another one is, believe it or not, the amount of body fat that you have. So the more body fat that you have on your body, the less severe that these symptoms will probably be. And that has to do with the fact that your body fat can actually create more estrogen out of different sources. Okay, so if you don't have a lot of body fat, then you're going to be able to produce less estrogen, and then you will have more intense symptoms. So that's kind of how it works. But then there are just some luck of the draw women based on genetics who just really don't experience symptoms at all. Now, let's talk specifically about these symptoms because I want to describe them to you. Before I do that, let me just say that treating women who are in menopause used to be one of my favorite things to do because this was kind of before I started focusing on the thyroid, because you get such dramatic results so quickly. So I want you to know that these symptoms can be very severe, and like I said, you're probably going to notice that they're there. But the good news is there are treatments, which we'll talk about as we get down here. There are things that you can do, and in a lot of cases, you can just completely eliminate these symptoms, okay? So we'll talk about those when we get there. So let's focus on the symptoms first. The first group of symptoms that I want to talk about are called vasomotor symptoms. So that's what your doctor will refer to them as. And they include a group of symptoms, which all kind of have a similar theme, and I'll explain them to you. Now, the first would be hot flashes. So hot flashes are just rapid rise in your temperature. This can happen when you're awake. It can happen when you're sleeping. It can happen pretty much at any time of the day. And sometimes the temperature changes will trigger these hot flashes. Okay, another thing that can occur inside of these vasomotor symptoms would be night sweats. So if you wake up drenched, if you go to sleep, you're feeling good and it's a cool night, let's say, and you just wake up drenched, that is not normal. In fact, night sweats are never a normal sign or symptom. And then lastly, if you don't have a real intense hot flashes, you may just experience flushes. So flushes just meaning that your skin just feels hot, and we're talking temporarily. So these hot flashes they can last for a couple minutes, they can last a little longer, and they can just come out of the blue. And they can vary in terms of severity. So you can have really, really hot flashes where your face gets red and you feel like you're hot and you could be sweating quite a bit. Or you can just have a little minor flush where you feel your skin, getting a little pink, let's say, and just warming up slightly, but you're not really sweating and you don't feel super uncomfortable. These are all classified under vasomotor symptoms, meaning that they sort of impact the system in your body, which helps to regulate temperature. So that's why they kind of all have to do with temperature: sweats, flushes, and hot flashes. That's why they're classified in this area here. Now, most women will experience these symptoms to some degree. Remember, it can vary from woman to woman, but these tend to be the most let's say intense symptoms, and these are the symptoms which tend to drive women into their doctor to say, hey, what's going on? Or let's get some testing done to see if I'm actually in menopause. Another big group of symptoms falls under vaginal changes. So estrogen is really, really, really important for the health of the vagina, okay? So as estrogen levels fall, you will start to notice changes into the, well, we're just classifying them as vaginal changes. Now, one of those is dryness, okay? That's a big one. And dryness tends to lead to a lot of these other issues, such as painful intercourse and decreased sex drive. So obviously the hormones do impact your sex drive, but another thing is you're really not going to be wanting to have intercourse if it's painful when you do, right? And then another, let's say, not really added bonus to this is that you have an increased risk of developing urinary tract infections. So these vaginal changes result in some serious symptoms which affect quality of life. And again, these women tend to definitely experience as well, and they may or may not drive a woman into the doctor, sort of depending on how severe that they are. I would say these are definitely some of the two most important in terms of symptoms and in terms of quality of life. And you can kind of get an idea of just how severe the symptoms can be just by what we're talking about right here. Another symptom that a lot of women experience is insomnia. And so again, insomnia is just the, you're unable to sleep at night. And a lot of this comes from night sweats, but hormones can impact how well you sleep regardless. So it could be, the insomnia could be related to the night sweats, or it could just be because your brain is just not able to relax or to calm down or actually to get into those deep REM cycles that you really want to be seeing. Another common symptom would be mood changes. Now, I see all sorts of mood changes in the women I've treated. I would say probably the most common is depression. You're just not feeling like yourself and you're not having joy in the things that you used to. So those are very common symptoms, but you can get all sorts of mood changes. I've seen anxiety as well, depression, again, all over the map. So mood changes are really non-specific and they can be related to other things, but they are a symptom of menopause as well. Another big one that I've talked about and I've actually written articles about, I don't think I have any videos on it, so I'll probably have to do a video on that soon, is weight gain. So this is really important. And one of the most important things that I could tell you as a woman, if you haven't hit menopause yet, you want to go into menopause at a normal weight. Because if you don't, women who are actually a little bit overweight when they hit menopause gain on average something like 15 to 20 pounds. And some studies put that as high as 25 pounds. So just this drop in estrogen and progesterone can trigger this degree of weight gain by itself. Okay. And it seems to be, in my experience, and it seems to be based on the studies, that if you have any existing problems before you go into menopause, menopause just takes those and exacerbates them. It makes them way worse. It's not like a 1 + 1 = 2 type of thing. It's like 1 + 1 = 4. Okay. That's why these women who are just a little overweight, who go into menopause, gain a significant amount of weight compared to women who are not overweight. In fact, if you're not overweight, you're very unlikely to gain any weight as you transition into menopause. So if you haven't already, stop right now, get that weight taken care of before you hit menopause. And if you're a woman, you should be taking care of your weight as soon as possible, because weight gain just tends to impact women a lot differently than it does men. It interferes with thyroid hormones, cortisol, sex hormones, and everything. So it's just better to be a normal weight as a woman for all of these hormonal reasons that I mentioned here. Another, let's say not quite as intense symptom, but something that you should be aware of, is you can experience a reduction of the glow of your skin. And this kind of goes with, we're going to put all these together because these are really cosmetic changes. So estrogen is really important for giving the curves, even in the face, by the way. We're talking all over the body, but especially in the face. So this comes from the subcutaneous fat that is found there. So estrogen stimulates those fat cells and provides curve, and it provides volume in those areas. And what happens is as estrogen levels drop, the subcutaneous fat starts to shrink away. So it can kind of reduce the quality and texture of the skin, let's say, and it can reduce the glow. So if you know what I'm talking about, if you've ever seen a pregnant woman, or if you've ever been pregnant yourself, your skin really just seems to glow. It just has a different texture, it has a different look to it, and you can tell right away. In fact, a lot of women, if you just eyeball other women, even when they're early in their pregnancy, other women will say, yeah, that woman's pregnant, I can just tell, I can see it in her skin. And that's where this comes from. And of course, this will cause increase in wrinkling as a result. So estrogen, again, is very important from a cosmetic standpoint, but also from the standpoint of quality of life, as we've mentioned above here. There are some other ones here, so we'll go over these a little bit briefly, because we could spend a lot of time talking about these. But a lot of women who enter into menopause do experience a decrease in energy, which we're going to call fatigue. Now, again, fatigue is non-specific. It can be caused by a lot of things, so you don't focus on that too much. It can also result in joint pain. So hormones, in fact, especially thyroid hormone, can impact your joints. Another important aspect would be bone loss. It turns out that estrogen is actually very important for maintaining bone density and bone structure in women. So what happens is as estrogen levels fall, remember we talked about that, you have an increased risk of developing osteoporosis. and osteopenia. One is just, minor bone loss up to major bone loss. So that's really just the difference in those descriptions there. And really what the catalyst for this drop in bone mass and the increased risk of fractures in women as they age is related to this drop in estrogen. So that's another important thing. And then another really important thing that probably most women aren't even thinking about is estrogen plays a protective role on both, well, actually in a lot of areas, but your brain and your heart specifically. So as estrogen levels fall, you gain an increased risk of heart disease, including heart attacks, and also Alzheimer's and stroke. Okay. And so these things, estrogen plays a very protective role in these aspects, which are very fatal to a lot of women, but they really don't experience them later in life. So they're not really, top of their mind in terms of importance to them. But, if those aren't really important to you, then everything else might be enough to get you to look into the treatments, which we'll talk about in just a second. And then lastly, no hormone change would be complete without the addition of something like acne. Now, just like estrogen and progesterone can impact your skin, it can also increase your risk of acne. So if you just have acne out of the blue, you've never had it your entire life, and all of a sudden you turn, let's say 50 or so, and you start to develop acne, it's probably related to the hormone changes that are occurring in your body around that age. And I didn't mention, by the way, I should have, but the average age that women go through menopause is somewhere around 50 to 51. But don't focus too much on that. That's just the average age. The way that I really try to estimate when menopause is going to happen in an individual woman is by asking them when their mom or when their sister went through menopause. So if your sister or mom went through menopause when they're 45, there is a good chance that you are going to go through it at the same age. Likewise, if your mom or sister or aunt or whatever had it at 55 or somewhere between 55 and 60, you're most likely going to mimic them. And that's that genetic component that I was talking about previously. So is it all bad news? Is there nothing you can do? No, not at all. In fact, it's kind of hard to see these, but we'll talk about these things as we go along. Now, probably the fastest way to treat menopause, and I don't want to focus too much on these treatments. I'll do another video specifically talking about treatments because it's a very complex topic. But probably the fastest way, in my experience, to completely, and I'm talking completely eliminate menopausal symptoms is with the use of bioidentical hormone replacement therapy, also referred to as HRT. Now, this is not the same thing as using synthetic hormones that your doctor may want to prescribe you, including high doses of synthetic estrogen. They will, if you use those type of medications, they will eliminate these symptoms, but they come at a cost, and they come at a cost in terms of risks of other diseases down the line because the dosing can't be controlled that well. But HRT, if you're using bioidentical hormones, can really be, let's say, curative in a lot of this because they can completely eliminate all of these symptoms, or at least improve your quality of life by like 90 to 95% rather rapidly too, by the way. Like I said, it was one of my favorite things to do because you'll have a woman who comes in and she is just really suffering. And in 2 weeks later, completely back to what she perceived as her normal, quality of life and normal living standards. It happens that quickly. So another thing that you can do, or that some doctors will say, is they'll say, hey, guess what? It's inevitable. If you don't want to use HRT, or maybe you can't because you have a history of cancer or breast cancer or something like that. Time does tend to have some impact on these symptoms in terms of severity. It's not clear whether you're just getting used to it or whether your cells become desensitized or resensitized to a lower level of estrogen, but time can play a role, by the way, just so you're aware. I don't like that as a treatment, obviously, because I just don't think that's a good thing to say to a woman who's suffering, well, just give it 5 years and it'll go away. That's just, I wouldn't like hearing that, and I don't think a lot of women would like hearing that, but it is potentially a treatment nonetheless. The other thing that you can do is you can actually consume foods which are naturally high in what we call phytoestrogens, meaning food-based estrogens. So some foods are actually quite high in natural estrogens, which can stimulate these estrogen receptors and reduce the severity of these types of symptoms that you're experiencing. Now, I don't always recommend this because some of those foods can carry with them other problems, but an example of a phytoestrogen type of food would be soy-based foods. So soy, which is why, by the way, I recommend that a lot of men do not consume soy, is because they have a estrogen stimulating effect, whether it's in a man or a woman. Now, in a woman, it can be useful, if you're low on it, but in a man, you generally don't want it. And also in a woman who is not menopausal, you generally don't want it. So I'm very reluctant to hesitate things like soy, but to give you an example, certain foods can actually elevate estrogens and reduce the symptoms that you're experiencing. And then lastly, I'll pull this up here, you can use over-the-counter supplements. So a lot of supplements, including progesterone, by the way, they're available over the counter. So you can actually replace the progesterone levels that your body has lost by purchasing an over-the-counter progesterone cream. Now, there are certain types of estrogens as well that are available over the counter, but you can't get the most powerful and most potent estrogen, which is estradiol, which I refer to as E2. So you can sometimes use supplements. There are other supplements as well that do not contain progesterone and estrogen, but nonetheless still have a stimulating estrogenic effect, which I have a whole blog article or a blog post on that as well. I'll do another video because, like I said, these are very in-depth topics, each one of these down here in the treatment section. But I would just want to let you know, if you're a woman suffering from these symptoms, there are things that you can do to treat them. So I know this is probably a lot to take in. We talked about a lot of symptoms here, but if you have any questions about the symptoms you're experiencing, maybe you want to know how to know if your symptoms are related to menopause versus thyroid versus other things, because again, there's a lot of overlap here between these hormonal conditions. Let me know. Leave your comments below, and I will, if necessary, I'll do another video to sort of outline the difference between these symptoms, how to tell or how to test specifically for menopause, and so on. So leave those comments below, and that's all I have for you guys today, and otherwise I will see you in the next one.